Hello everyone in Foundations of Global Health. Today we're going to talk about health system strengthening.
For our presentation, we'll start by introducing the health system strengthening. Then we'll go on to focus on the variability of the problem, then entities responsible for action. Then we'll provide a critique for exactly what is working and what's not, the priority areas of action that we need to take, and then we will end with our references.
So let's begin with the importance of strengthening health systems. When we look at global health systems today, 2 years into the COVID-19 pandemic, it is evident that most shortcomings will be highlighted by the pandemic. And while global health initiatives such as the fight against AIDS, malaria, influenza A, or SARS have had great achievements over the last 10-15 years, and the mobilized response to Ebola in 2014 and 2015 appeared to be an important milestone in global health system strengthening, the COVID-19 pandemic proved that there was great work to be done in global health system strengthening. And looking to the future, we know that we need to develop the most vulnerable nations' health systems in order to protect global health systems of the highest income countries and the lowest income countries. Additionally, cooperation between national health systems is a key factor in providing a global health system that is easy to respond to global health challenges. And lastly, current global health system metrics are very poor, with over 5 million deaths worldwide being attributed to poor quality care. This was even before COVID-19 has further challenged the system. So COVID-19 showed us the many ways that our global health system fell short. Ideally, the global health system should be resilient to something like COVID-19, and it wasn't because of the undeveloped and interconnected components that fell short and often failed. Here we can see what a possible health structure that is resilient to challenges might look like. It has a balance between the workforce, the technologies employed, the public health functions of the health system, how the healthcare is delivered, and the financing and governance that goes into the system. Though this is one of many, the possible resilient health structure provides for better health equity and outcomes even when challenged by regional endemic challenges as well as larger ones like COVID-19. Later in the PowerPoint, we'll go over possible building blocks to a strong health system. The past couple of years have highlighted a trend that's likely to go into the future of a populist nationalism movement within the healthcare sector of prioritizing one's own health system before another. Rooted in principles of anti-globalism, this ideology has done much to hurt global health systems during the COVID-19 pandemic and is likely to be a subject of regional and national politics. And because of this, the threat of deterioration of our global health systems is high, and we must focus on strengthening every health system of every region and every nation to protect the greater system.
Hello, my name is Enoch Obing. I'm going to talk about the variability of health system strengthening worldwide. As you can imagine, there's quite a bit of variation related to factors that we will discuss shortly. This word cloud shows USAID's health system strengthening priority countries. Well, what would make a country a priority country in terms of health system strengthening needs? Well, USAID defines that as countries receiving 3 or more types of health funds. Health funds can be allocated for a number of reasons, including but not limited to higher communicable disease burdens and higher family planning needs. Now take a look at the word cloud once again. Do you notice a trend? Keep that in mind as we move on to the next slide. If you notice that the trend is that these countries are predominantly located in Africa and Southeast Asia, you would be correct. So we talked about these countries being allocated increased USAID health funds for various reasons. Let's take a look at some specific areas where these countries show their need for health system strengthening. Various measures of mortality rates are an obvious area for health system strengthening, but we will start by looking at global infant mortality rate. Notice the intensity of the orange coloring in sub-Saharan Africa and various parts of Southeast Asia, indicating the elevated infant mortality rate. This is just one example of an elevated mortality rate, but research on your own would show other elevated mortality rates, an obvious area of health system strengthening needs. So, what causes the problems of elevated mortality rates and elevated disability adjusted life years seen in the previous slides? Well, that would be lack of reliable healthcare. Medical doctors per 1,000 people will be used as a proxy for reliable healthcare. Notice the change in intensity of shading globally. Countries that have previously showed bright hues indicating elevated infant mortality rates and elevated disability adjusted life years are now pale in comparison. The US is doing okay in this front, but note how Europe reigns supreme with this proxy measure of health system robustness. It shows countries that have passed legislation on universal health care coverage. Universal health care coverage is one way to make healthcare more reliable and accessible, i.e., strengthening it. It can be argued that countries without universal health care coverage need more than foreign health funds, but policy and novel strategy implementations. There are several groups and entities helping on this front as well.
Hello, my name is Sophia Friedman, and I'm going to be discussing the entities responsible for action in the area of health system strengthening and what they have done to address this topic. So, who is responsible? Well, the World Health Organization, in fact, views itself, and many others do as well, as the leader of the health system strengthening agenda. This is partially due to the fact that they developed the framework for health system strengthening, as seen on the photo in the slide, that is used by many countries and organizations. They also established the International Health Partnership for Universal Health Coverage 2030 program, which leads the mission to accelerate progress towards universal health coverage through strengthening health systems, which is associated directly with SDG 3.8. And the World Health Organization has placed health system strengthening as a priority in its work. In reality, though, there's been a paradigm shift in public health in the last decade from a vertical approach to a horizontal approach, and all organizations interested in both public health and international development have a role to play in health system strengthening. So a vertical approach is an intervention that is specified to address a certain disease, specific issue, where horizontal approach addresses the health system in order to provide a foundation for better health in a population across many different areas. So many organizations have recognized the importance of health system strengthening as a fundamental necessity for change in global health to achieve their goals and better global health overall. So for this reason, any organizations interested in public health or international development, whether philanthropic, international governments, NGOs, public-private partnerships, and international development agencies, have contributed to health system strengthening through direct action, changes to their philosophy, or by aligning with initiatives such as the Universal Health Coverage for 2030. So on this slide, there's some examples of organizations and agencies that have taken action on health system strengthening. So we have USAID and Gavi and their websites that have their statements, as well as a report by UNICEF. And I'll expand a bit on Universal Health Coverage 2030 by reading an excerpt from their website as they're the primary dedicated global initiative for health system strengthening created by the UN. So UHC 2030 provides a multi-stakeholder platform that promotes collaborative working at global and country levels on health system strengthening. We advocate increased political commitment to UHC and facilitate accountability and knowledge sharing. In countries receiving external assistance, we continue to promote adherence to effective development cooperation principles as the most important way to ensure coordination around health system strengthening. So additionally, on the PowerPoint, there's a list of all the countries, global organizations, and global initiatives, philanthropic organizations, and civil society organizations, as well as the UHC 2030 initiatives that they've created themselves that are all associated with UHC 2030. So as we can see, it's quite a large project. So, while all organizations interested in global health and global development have a role to play in health system strengthening, the way they do that can be different. So, almost all organizations provide some degree of technical assistance. Specifically, the WHO, they're primarily a technical agency, but there's other entities such as bilateral and multilateral donors, public-private partnerships, and private foundations that are primarily donors providing funds to strengthen health systems. And then the method of providing this technical or financial support may depend on the nature of the organization. So, some organizations which are disease specific will take a different approach to organizations that have a broader perspective on health, such as usually typified by bilateral development agencies. So on this slide, there's a bit of a timeline about the work that's been done in health system strengthening by And just to illustrate the expansive list of organizations involved in health system strengthening, I wanted to list the organizations that are involved in creating the NGO Code of Conduct for Health System Strengthening in 2008 that I spoke about earlier, and the 13 agencies which are part of the Global Action Plan for Healthy Lives and Well-Being for All, which I just spoke about.
Hello, my name's Dave, and we'll be critiquing the current solution that we have in place for strengthening our health systems. When focusing on our HSS or health strengthening systems, we focus on the amount of support we've had within the groups for the past few years. So within the last 2 decades, we've had tremendous growth in the political will, our funding support, and the structure in order to improve the healthcare standard. While there have been a lot of gains achieved in some areas, such as HIV epidemic, there have been grounds where we have basically reduced the amount of improvement we've had in other areas, such as primary care and maternal child health. It's become pretty clear that NGOs can really undermine the public sector and the healthcare system as a whole by diverting healthcare workers, managers, and other leaders into a private structure in order to worsen the system for other people that aren't necessarily in areas that can properly be funded. There's a lack of what HSS can do and how we can achieve it. So with increased global engagement with health systems, it's considerable that there are a lot of gaps within our strategies that are reducing the amount of healthcare being provided to other individuals. So the challenge posed is that while there are improvements and there are other standards being applied, we're missing the big picture on making sure preventative care and other health is being established and maintained amongst our people within our countries. Now, despite widespread agreement on the importance of public health, the global community has failed to deliver an effective healthcare model. So in the US specifically, we're seeing a failure where the cost of care is simply too high for people to afford. One big difference between the US healthcare system and other countries is we're seeing that pharmaceuticals are monetized and more catered to stakeholders and profitable than to actually provide use and care for others. One solution is to have increased governmental support in regulating the cost of these pharmaceuticals, because the price of insulin, for example, in this country is a lot higher than the standards of others, and we don't have a universal healthcare model. So without this universal healthcare system, we don't have the ability to provide for others and to provide for them basic necessities if they are needing materials for preventative care or even post-infection care. So we're seeing that within this, because of the lack of government interference with pharmaceuticals, there's a lot of lack of insurance coverage. Without our universal healthcare model, which would be a solution for it, we would be able to factor in the cost of this and provide all of the cares that are necessary for it. And we are seeing in European countries, ones that do have a universal healthcare model, they are doing significantly better than most countries that do not even have a standard healthcare practice or system in place for them just to have basic needs met. We also have a medical staff shortage. Now, with this medical staff shortage, we see during COVID that there's a lot of fatigue going on amongst our staff members and they're overworked. And the solution for this really is to either increase the amount of help that we give towards our healthcare providers or even have an increased pay for a benefit in order to incentivize our groups for the long labored hours that are enduring. Unfortunately, it isn't as easy as hiring on a bunch more doctors and training them, but it's a matter of making sure we have the resources necessary, because without having certain technologies or without having certain equipment, we are basing ourselves more on our medical staff and requiring them to work more than to provide streamlined services to our groups that may need health and help care. So without that, we are seeing that basic needs aren't being met because of governmental lack of coverage, and also because we are pushing the limits of our current outdated program that is going on today. So without universal healthcare coverage or even potential governmental support to regulate different pricings, we are seeing the point where we won't be able to keep up with the current healthcare model system, and instead of strengthening, we're just weakening the system.
Hello everyone, my name is Ava Niknajad, and I will be discussing the 3 priority areas for action concerning health system strengthening. According to the World Health Organization's Health Systems Framework, there are 6 building blocks of a health system: service delivery, health workforce, information, medical products, financing, and leadership. It is a system for us to understand where the weaknesses lie and make proposals to improve on those. Therefore, strengthening any of the building blocks of the health system will have positive ramifications. This system must be approached holistically as opposed to individual parts. All the building blocks are integrated, so if you target one individual building block, you will have a spillover effect and will target to other building blocks. This is a good framework to have in mind going forward as it allows us to have a holistic perspective on tackling global health challenges. The 3 priority areas that I will be talking about are regulation, financing, and human resources. The first priority area is regulation. This includes accountability. If accountability is strengthened, the chances of corruption diminish, and responsiveness, equity, and efficiency increase significantly. The United States Agency for International Development defines accountability in the context of health systems as ensuring that officials in public, private, and voluntary sector organizations are answerable for their actions and that there is proper redress when duties and commitments are not met. Accountability can be in the form of performance dashboards that document how well the organization is doing to achieve a handful of key indicators of success. It can also be quality assurance of providers and the workforce in addition to training. Under regulation include policies and framework. Formal institutions such as policies and informal institutions such as norms of behavior needs to be established to adapt and interact in ways that improve population health. COVID-19 has unveiled the fragile state of the world's health systems. COVID has exposed weak policy frameworks that are fragmented and lack clear articulation of responsibilities. Additionally, more often than not, policies exist not because they are the most efficient, but because of historical antecedents. Therefore, policies must be driven by on-the-ground agents instead of driven from the top down. An example of this on-the-ground approach is the African Center for Global Health and Social Transformation. This is an initiative of a network of African and international leaders in health and development. Their policies and strategies are owned and driven by African populations themselves. As a result of this, they function as an independent think tank that forges an alliance with organizations in Africa and around the world, focusing their efforts on Africa's engagement with global partners in health. Under regulation is coalitions. Community coalitions can catalyze important changes in health and well-being of populations. Community coalitions may collaborate with formal providers and the government to promote and enforce cost-reducing referral practices. Examples of coalitions include Girls Not Brides, which is an international non-governmental organization with the mission to end child marriage. Another example is the International Conference on Family Planning, which serves as a strategic inflection point for the family planning and reproductive health community worldwide. And another example is the Frontline Health Workers Coalition, which is an alliance of United States-based organizations working together to urge greater and more strategic investments in frontline health workers in low and middle income countries. The next priority area is financing, and this includes improving or developing prepayment risk pooling. Costs of healthcare are increasing yearly. Patients are forced to pay more for treatment, and this causes many to fall below the poverty line. There are a few financing models that help to achieve universal healthcare coverage, such as high-risk pools like health insurance and prepaid schemes. Risk pooling is also known as health insurance, which is a group of persons contributing to a common pool, usually held by a third party. The risk of having to pay for health care is carried by all members of the pool, not just by one contributor individually. The more the degree of pooling, the fewer people will have to deal with financial risks. Financing also includes adequate funding from domestic sources. Low and middle income countries face challenges in financing essential public and personal health services. On average, almost 50% of healthcare financing in low-income countries comes from out-of-pocket payments, as compared with 30% in middle-income countries and 14% in high-income countries. Some possible strategies to increase domestic funding for health include low and middle-income countries redistributing existing government revenues to health, or reducing subsidies on other areas such as fossil fuels to spend more on health. Funding can be increased through financial arrangements between government and non-governmental sectors. Additionally, increasing availability of key information is crucial. Transparency on information about how much is spent on health, by whom, and who benefits is very important to increasing health system strengthening. There must be mandates to report financial data to oversight organizations through electronic systems. In public health, there must be a data set that documents the dedicated jurisdiction taxes for essential public health services. The last priority area is human resources. A highly skilled, well-supported, well-distributed, and motivated health workforce is vital to improving people's access to quality care. We need to prioritize international norms, standards, and databases. The Global Health Workforces Standards can be maintained through the International Standard Classification of Occupations, International Standard Industrial Classification of All Economic Activities, and International Standard Classification of Education. These standards help clearly define occupational groups within and across countries. This involves a broad scope of activities, including accreditation of educational institutions and programs. Moreover, in order to scale up health professional education, the quality and quantity of health professionals must be addressed through training. This involves accreditation of educational institutions and programs, or certifications licensing such as basic medical education. And finally, collaborating across different disciplines, experiences, and borders will be key in improving health system strengthening. Establishing international definitions and indicators will help set norms and standards. Thank you for listening to our presentation, and if you have any questions, please post on the discussion board. Thank you.